What's up? What's up, Miriam? What's up, Miriam? Miriam, what's going on? Abdul Ram. What's happening, Abdul Ram? Shiva, what's happening? Okay, I just let Telegram know. Now it's standard. Let's let Instagram story know. Miguel. Hamza. Mustafa. Champion. Letting IG story know. Pretty standard, right? Okay. Azik. Aditya. Hey guys, I have an idea. Don't give the live stream a like coming in. Don't give it a like. Don't give it a like, right? We don't need likes on the live stream, right? Right? Free advice, no likes, right? I'll ask for free advice, no likes. All right, Tamur. I don't know what that is, bro. Internal med. Who says I med? I've never heard anyone say that ever. It's just I am. I've never heard anyone say I med. I thought you were talking about like a different form, like IFOM or something. I had no idea what you were talking about. I think you mentioned that in like a different live stream as well. I literally thought you were talking about like some exam in like Ireland or something. I'm like, the IFOM? Like, what the fuck are you talking about? Andres. Step 1 tomorrow. Good luck tomorrow. Tips on test day. Well, first of all, today, have a chill day because it's almost 2 a.m. here in Japan right now. So it would be about 1 p.m. East Coast US. So have a chill day today. Don't eat too much for the rest of the day. Maybe have like what you guys eat in the United States. You could have like a slice of pizza or something. Or Andres. I don't know where you are. You're like in Mexico? Where are you? Don't have like don't have like 3 enchiladas or something tonight. Right? So for test day, I would have a light breakfast, no proteins really, just like bowl of cereal, maybe half a banana, and then I would have caffeine. And for your blocks, I would do the first 2 blocks back to back with no break. Take 60 seconds sitting at your desk without leaving the testing room. After the second and third blocks, just have a few sips of water, a few sips of caffeine, no calories. Actually, it doesn't have to be no calories. You can have like half a protein bar as well and just a little bit of caffeine. After the fourth and fifth blocks, you can have, let's say, half a PBJ sandwich. You don't want proteins. You want like just pretty much like simple sugar and complex carbs, and have more caffeine. Don't take an extended lunch break on exam day. So you just want 5 minutes, 5 minutes, 5 minutes, 5 minutes all the way through. But the first 2 blocks back to back with no break to gain momentum early is what I would recommend. But over caffeinate is my advice. It's better to be tapping your foot in atrial flutter than it is to be a partial crackhead. Okay? Saad. What's happening, Saad? Bezad, what's happening? Gohar Ali Zafar. Your free 120, 74% exam in a week. Step 1 or step 2. But either way, 74 is good. So if it's step 1, obviously that's very high. If it's step 2, that's a 240. So exam in a week, just focus on the NBME exams right now. Sylvester Gomez. I have 85 plus in NBME, but I feel like I'm failing my step one. Is it normal feeling? 85 isn't even close to failing. Like I just literally put out an Instagram reel and short here on the YouTube saying like how you feel coming out is uncoupled. It's untethered to your actual performance where you can feel like shit and have done well. You can feel pretty good, have done shitty. So it's uncoupled, but to be scoring literally 85 plus, as you put it, and to be worried about failing is like, that's like delusional. Because like 85 plus is very, very high. 65 is a pass for step one. Shiva, you're going through arrows. Chat moved on me. You're going through arrows. That's good. Bezad Raza, could you tell me the don'ts of 2CK prep? I mean, how about the don'ts of just USMLE prep in general? I've said that a big don't is taking what I think you should not do is annotate from QBank and make your own Anki cards from QBank. This has nothing to do with Mehlmanmedical. I'm saying like, if you're going through and you're like, how am I going to remember this stuff? I got to take notes. I got to make Anki cards. I got to make my own like cards. Waste of time. Waste of time. That's how you don't make progress. It's vastly, vastly, vastly overrated, the notion that you physically writing notes or making cards is going to help you with your prep. That doesn't help. It only helps if you review later. However, rather than spending that time reviewing those notes later that you make or those cards that you make later, I would rather just have you do more questions from QBank or spend more time on the Mehlman Anki that are already better than your Anki, or focus more on the PDFs, do more of our YouTube clips. Because the notes that you make as you're going through QBank, as you progress, that info is going to be very silly. Because your knowledge base is going to expand and you're going to look back at your old notes and you're going to be like, dude, that was like, I thought that was like hard. I had to write that down. Like that was difficult for me. I had to write that down. Crazy Arabic name that I can't read. Your PDFs are enough without videos. Well, if your retention is good, some people can retain, but most people can't read. So you got to be doing active questions, and I'd recommend doing our YouTube clips also. Mariam, so you're using UWorld so far. I'm thinking to switch to your QBank. What do you think? Guys, I've said you can do UWorld. Like if you're doing UWorld right now or Amboss, that's your current QBank, you can do ours at the same time or after and have that juxtaposition, that point of comparison, and you'll see ours is better. So I'm not saying like you have to quit your QBank and switch to ours because, you know, I'm not saying that. I'm saying have the juxtaposition, do both, and you're going to be like, fuck, Mehlman's is better. Mohammed Hassan. But I mean, if you're poor, then obviously that's not going to be a consideration. Like many of you are poor. So that's not like, most of you guys, like you struggle over like a $12 sandwich versus like a $14 sandwich. Like those are the dilemmas you guys think about, most of you. So like, don't do our QBank. We don't want you to do our QBank. Mohammed Hassan, can you summarize the bullshit of cervical cancer screening? I mean, that's a long discussion. You want all the management for all the different types of pap smear stuff, colposcopy and biopsies and cone biopsies and all that stuff. I would say the highest yield point on 2CK3 regarding that stuff is just that you don't do it before 21. That's the high yield point. You might have like a 16-year-old girl who she's sexually active, and then they'll want like gonococcus chlamydia screening. Like you still do that in someone who's sexually active under 21, but you don't commence pap smears under 21. And you also don't do HPV testing in the 20s. So 21 to 29, you do every 3 years. no HPV testing. And then at age 30 upward, they start with HPV co-testing. It's every 5 years. And you can stop at age 64 pap smears. That's the highest yield stuff. And HIV is every year. HIV is at the time of diagnosis and annually, not every 3 years to 5 years, every year in HIV. Cone biopsy shows up once on an OBGYN form. It's the answer when they do a colposcopy and biopsy, and they will say the entire squamo-columnar junction cannot be visualized. So cone biopsy shows up once. Topper tricks. I can't remember my URL as such. Can I give my exam after seeing your videos? I mean, our videos, the YouTube, it's a QBank. It's a video QBank. So you can do like Mehlman written QBank. You can do Mehlman YouTube QBank. That's 2 QBanks. One is free. Thank you, Gull Hummer. Twin cylinder, good to see you back. NBME scores around 60. Exam on the 9th of September in a week. Can't delay med school issues. Any advice increasing chance of passing? If you're getting 60% and you cannot move your exam, you're going to have to just sit the NBMEs, and you need to get 65 plus to pass. If you can't get close to 65, you're not going to pass. And I would do whatever you can to postpone that. I would rather have you get into issues with admin at your school, get a doctor's note, whatever, than to just knowingly take a fail on USMLE. You can YOLO, but you're not going to pass because some admin is no, you're not allowed to move your exam. And meanwhile, if you just don't go, they're probably not even going to do anything. You don't want to take a fail on this step. If you do fail, it's not that it's insurmountable. You can match. It's just, it's one thing to have it be a surprise. It's another thing to go in where objectively your scores are not passing and then expecting a miracle. So we want to see NBME 68 plus, 3 of them at least, for safety / a buffer. 65 is your pass mark. Kalikli, you've done all the systems with Mehlman PDS. Now you have neuro and basic sciences left. How do you do the basic ones first? Which ones do you have left? You said you just did all the PDS, all the systems, cardiopulmonary, gastro, heme. That's what you're talking about. You've done. You got neuro. Just do them all. Just do them all. How are Japan huzzes? I don't know what that means. I've lived in Japan 9.5 years. I don't know what that means. So if that's something obvious, that shows you that that's a foreigner thing, that people who actually live here. You get Japanese wannabes where they'll say certain things. They'll be is there this? It's when I lived in Australia. I lived in Australia for 7 years. And you get foreigners who are is there shrimp on the Barbie? There's no shrimp on the Barbie in Australia. There's no crocodiles in your bathroom in Australia. You get spiders in your bathroom, not crocodiles though. My old Japanese immersion school though, the location was on this dodgy side street where there are all these maid cafes. You can't make this shit up. So it was literally you'd walk out of my old immersion school and there'd be all these maids in the street and stuff. And we as the foreigners coming in, we thought that was normal. We were Japan's all these maids, all these anime maids. And then as I've lived here 9.5 years, I look back at that. I'm dude, the school was in the dodgiest location. It wasn't red light district, but it was they had this Japanese immersion school smack dab in the middle of this street with all these maid cafes and stuff. And we thought that was normal Japan. It's no, it's not normal Japan. It's normal if you search for it, but it's not That's not like everywhere you go. Bezod, should I do the Anki for 2CK prep along with your QBank and PDS? Also, what about YouTube questions? For regardless of 2CK, you can do our Anki for any of the steps alongside QBank, yes. Champion, what do you do when you're stuck between two answer choices? When you have eliminated the other options? Common things are common, so go with the common answer choice. Okay, so the answer really is just asthma, not bronchoalveolar carcinoma. Okay, so choose common answers when you're not. If you don't know an answer, don't choose weird sounding shit. I've said that. And go with your gut. So if you enter a question, you're reading it, you're like, it sounds like sickle cell, and then you see like thalassemia there, it's wrong. The answer is sickle cell. So go with your gut. Don't change your answer when you don't know the answer. If you're not sure, don't change your answer. Only change your answer if you absolutely overread something, such as like all of a sudden there's a fever. You're like, oh shit, I didn't see that. That's different. But if you're like sitting on sickle cell and you're not sure what the answer is, don't change your answer. Shiva, you're finding it difficult to do 40 questions in your QBank plus going through PDF same day. I have to alternate. No, I want you doing 40 questions a day regardless. That's not a lot. 40 questions is nothing. That's nothing. So you need to do 4 blocks of 10 untimed tutor random and not procrastinate. Your phone's got to go in another room. You're just procrastinating. Under 40 a day, not acceptable. If you got a full-time job or something, that's different. But do the questions first, and then you can go to our PDFs and Anki and do that stuff, but never fewer than 40 a day. Thank you, Kenji. Hamza, what is the most predictive assessment for 2CK? They're all the same. 6 through 15, they're all the same. Doesn't matter. It's like for step 1, you could do like offline NBME 4, which I did online. I did NBME 3 online for step 1 in July of 2012. You could do that, and it's still as predicted as 32, I would say. Have I looked at 32? No. But I'm saying like you could do NBME 27, do NBME 20. They're all predicted. They're all the same. Why did you leave Harvard? I didn't say I was at Harvard. I have a family member who went to Harvard for 9 years. I had like some connections there possibly, but it didn't go that direction. NU1L. Hey, Mike, I had 73.5 on NBME 25, 81 NBME 26 after a week. Should I register? Those are high scores. You're ready. Tamur, you're saying schools in Texas say IMed to internal med? Okay, never heard that. Werner. Ajibola. Ajibola, I've been seeing your name around. I'm trying to think of where I've been seeing your name. Maybe Instagram or something. I can't remember. Any tips for NBME anatomy concepts? Just do our MSK anatomy PDF. And obviously you can do like MSK anatomy and Mehlman QBank, but we've got a good anatomy PDF, anatomy MSK rheumatology PDF on the free stuff tab. Hamza, when finishing cores and want to take step 2, should I reset Mehlman QBank and retake it, or should I only do the incorrects? I mean, you can do Mehlman QBank once effectively. Make sure you do all the CMS forms as well. And as I said, within 2 to 3 months, we're going to have shelf QBanks out for all the rotations that are 1,000 questions. Okay? IM, FM, EM, Surge, Peds, OBSGYN, Neuropsych, going to have 1,000 plus shelf QBanks for all those rotations in addition to 2CK3, so you can do those for your rotations. The millionaire mindset asks, do you have a strategy for eliminating wrong answers to avoid falling for distractors? Not really, just knowing your stuff. Like distractors tend to be weird. Like if I'm with a student on Zoom and they choose a weird answer and it's wrong, I'll be like, have you ever fucking heard of that before in your entire life? And they're like, no. I'm like, why the fuck are you choosing it? So that's an observation I make is people choose weird answers when they don't know the answer. So don't choose weird things when you don't know. USMLE Prep asks, hey Mike, why didn't you pursue the medical career and switch into tutoring? I find you inspiring, by the way. It's not like I was always doing tutoring like way back in med school. Always like word of mouth. I was always tutoring. And then I moved to Japan after med school and I was still tutoring. And then I just like expanded it. It just like naturally happened. It was never, that was not my plan. But tutoring is like a very small like portion of what I do now. But that was not, it's not like I planned that. It wasn't my plan. I think I moved here for 2 years originally to do the immersion school. And then I thought about like, will I go back? Will I do family medicine in like Alaska? I want to do family or peds. And I was like, will I do family or peds in like Alaska or Hawaii? And then I realized the only reason those locations is what I was thinking about is because I had nothing to do with the profession. It was about the location. I was like, would I want to do family or peds in like New York or like Rochester or like, you know, North Carolina? The answer was no. It was Alaska. I was thinking Alaska or Hawaii. Why? Because I wanted to travel. I wanted to like experience stuff. And then I realized I'm like, I'm not interested in the career. And then I just built the tutoring stuff. And then, I mean, that's a whole separate thing, right? Hamza, love from Pakistan. Where are you? Islamabad? Is that where you are? Or is it like Karachi? Are you in Karachi? On my Instagram analytics, there's like a lot of people from Karachi. I'm just saying with the Japanese pronunciation. I don't know how you say it. But that's like a big city that like is people in Karachi are like following my Instagram. Israel, why did you leave medicine? I didn't leave medicine. I'm in medicine. Like if you're a pediatrician, you're an expert at peds. Like I'm an expert at USMLE. So topper tricks. Can I pass my exam after seeing your videos? Probably. If you do Mehlman QBank, the whole YouTube, you probably could pass. I mean, biostats, you should do like our course, our PDF, psych PDF, because I don't really focus on those subjects on the YouTube, but pretty much you could like do the YouTube and pass. You really could. I honestly think, I really do think that if you were to go through like all the YouTube questions and learn all those that I've done, you'd have a greater shot at passing USMLE than if you did UWorld. Now, obviously, if you do like a QBank like UWorld, you need to practice doing questions. Like if you do Mehlman actual written QBank, like you need to practice doing real blocks. So you can't like substitute that. You still need to do that. But I'm saying like knowledge base, like the theoretical knowledge. Like I think the YouTube's better than like UWorld. Werner, I was doing NBME 15 yesterday. I found it very easy compared to the newer NBMEs. Is it worth going through it's all in your head. It's just a form that happened to be good for you. Maybe it's all in your head because you'll do like, you know, NBME 13 and then all of a sudden it's hard for you. S. Crane Baderi, if you were a residency program director, what filters would you use to select candidates? I would look for people who've demonstrated hard work in producing stuff. Like this is 2025. Like I would look for people who have like made medical content through social, actually. That's like what I would do. Like I would prefer someone like, I'd be like, degree, who the fuck, like, what does your degree mean? Nothing. Like, I would just be like, what have you made? Like, what is your contribution? What's the other, your resume is like your contributions. Like, do you make medical content? Are you a content creator? Is that what you're doing? Now I understand that's like new school perspective, but people who've demonstrated competency in terms of making, in terms of having outputs and production, and people who they would have to come off like a team player in their personal statement as well. Okay, so people who talk about themselves, I wouldn't want to see that. Even if you've done amazing things, you don't want to talk about yourself really. You want to just talk about like, how you can work with a team and solve problems for a team. It's not about you. Ahmed Khan, Dr. Mike, nowadays people are saying the USMLE has big stems. How much of NBME concepts are repeating on the real deal? I've said a million times, the NBMEs are the real deal. They're the same questions. So the NBME questions that you're doing, they're the same exact questions on the real deal. The CMS, they're the same questions on the real deal. Okay. And we give you practice with long stems in Mehlman QBank. Okay. If you're doing Mehlman QBank right now and you've encountered some like very, very like long stems, that's me trolling. That's no one else. That's me. So if you've gotten like long poetic stems, that's me. Do you recommend to give NBME prior to CBSE exam? If this is okay to give NBME between 20 to 24, after 24, prior to your school's CBSE comp, you can do like half the NBME, so it doesn't really matter. Okay, because some of you are going to need like a 64 to pass, some of you need a 68 to pass for your school's CBSE comp. You can do like arbitrarily like half the NBME, so it really doesn't matter. I'll sometimes have students do like 20 to 27. And then I'll be like, we'll just save free 120 and 28 through 32 now for after your CBSE comp. But once you pass CBSE comp, you're ready to take the USMLE. 68 plus is what I want to see. Okay, so it's for those of you who have the 68 for your school to pass, you're ready to sit. 64, you're not ready to sit. Big D, you only have time for one more NBME. Do I take 30? When is your exam? Do you take 31 or 32? You want to know? Just do 32. Thanks to D2. Let me scroll back up. Chat moved. I'm just trying to find where I was. Where am I? Okay. Here we are. Nicolos. 75% done in QBank with 21 days left. You have biochem, ethics, genetics, infectious disease, micro. Is it better if I don't do micro questions and just do PDFs because I'm in a time crunch? 21 days. If you have 21 days left, I'd be on the NBME exams. I wouldn't be on QBank anymore. That's what I would do. You need to get to the NBME exams. At some point, something's going to get compromised. So you're either going to compromise QBank, you're going to compromise the NBMEs. And NBMEs are more important than QBank at the very end. Even if you're doing Mehlman QBank, and I'm flattered, like I would say at the bare minimum, like the final 2 weeks should be NBMEs, like pretty much only. The final 3 weeks in general, the NBMEs. Crazy new Russian name that I can't read. You got from NBMEs 25, 29, 68 to 75%. Is it safe? Yeah, that's good. Millionaire mindset. Can you talk about SLE? What do you want to know about SLE? The highest yield point for SLE for USMLE is probably recurrent miscarriages due to antiphospholipid syndrome and also thrombocytopenia. Those are two like of the highest yield things. And also 100% of vignettes present with arthritis. So most common presenting feature is arthritis. Okay. but recurrent miscarriages, antiphospholipid syndrome, lupus anticoagulant, okay, uteroplacental insufficiency, and thrombocytopenia. You can get antibodies against your hematologic cell lines. So you can get all the cell lines down. It looks like aplastic anemia. It's not aplastic anemia. It's antibodies against the hematologic cell lines. Okay. You get a lot of weird findings in SLE. You get mouth ulcers. You can get lupus cerebritis. It's confusion. Okay. You get transverse myelitis with Brown's acquired syndrome. You get a lot of weird findings in SLE. Okay. There's obviously more like basic things like anti-Smith. It's most specific, more so than anti-double-stranded DNA, right? The renal stuff, it's DPGN. If you have red urine with SLE, lupus nephritis, that's DPGN, diffuse proliferative glomerulonephritis. The Mallar rash, type 3 hypersensitivity. NBME 26 after, and my score after you completed UWorld and your score was, UW score was 40%. What is that question? What is that? What does that mean? Syed, like step by, like ask a question. Step by step with the timeline, how to pass step 1 as quickly as possible using Mehlman QBank, Mehlman Anki, YouTube questions. That is the way to go as fast as possible. I would do 40 to 80 per day in Mehlman QBank, and I would do 4 hours per evening in Mehlman Anki. Okay. If you're, you can titrate your number of questions in QBank based on how effective the Anki is for you. So sometimes people want to do like Anki like 12 hours a day. You could do like 40 questions in Mehlman QBank, then spend like 8 hours on Anki if you want. So you can kind of have days where you mix it up in terms of how many questions versus how many hours on Anki. And then the YouTube questions you can do in downtime, like when you're at the gym, you can listen to them in your pocket like a podcast. We have podcasts. Everything's cross-posted to Spotify. But you can have the YouTube questions in your pocket or on the machine next to you. If you're eating meals, you can obviously do the YouTube questions. I understand when those of you are like eating meals, you probably want escapism. That's your time to watch something that's not medical. I understand that. But if you're at the gym, if you're brushing your teeth, flossing, if you're cleaning, cooking, you can do the Mehlman YouTube questions. Thanks, Ravi. Big D, I already answered it. Mark Matthews, what are your thoughts on doing step 1 after clinical rotations? Terrible idea. I said that you never want to take step 1 during clinical rotations if you can help it. Schools that put step 1 after like 3rd year of clinical, it's not a good idea because you're going to want to study for clinical rotations on those rotations. So you're going to create a situation of conflicting study. Like you're on peds and you're like, I want to study peds, not like biochemistry for step 1. So it just creates a headache because then you're like, do I study step 2 QBank? And then that encompasses step 1 also? Like, what am I supposed to do? So it just creates a headache. So don't do step 1 during clinicals, after clinicals, nothing like that, if you can help it. Pegasus, NBME 30, 85%. Then you got a 75 and free 120, exam in 12 days. Just do the other NBMEs. Just do the other NBMEs. I want to know your other scores. You're fine. Not even close to not passing, so you're fine. Dr. NK, how to reduce silly mistakes after knowing concepts stuck between 2 options. I've already said, I already talked about that. Don't choose weird sounding shit. Don't change your answer when you don't know the answer. Those are like the 2 most basic things you can do. Go with your gut. Don't change your answer. Do not change your answer when you don't know the answer. Abdul Malik, can I hit 270s even though I felt garbage after exam, got 81% free 120? 81% free 120 is like not high if you're trying to get 270s. So you'd have to have done better than that. But if you had NBMEs that were like 270s, then that's obviously a positive thing. Navleen Singh, you postponed your step 1 for a month because earlier it was on the 11th September. You gave NBMEs earlier, you got 50% average. How should I prepare for the next months? I've already done your PDFs once. It was on September 11th. You postponed. Okay, so you're going to take it October 11th, and you had a 50%. Well, you're nowhere near passing. You would have to, honestly, you'd have to like, I would honestly recommend blasting through Mehlman QBank, because here's the deal. You need to end on the NBME exams, but you're not ready yet to sit the NBMEs because you're failing them. So we don't want you to burn through the NBMEs while you're failing them. So what do? We have you do QBank. So what are our options for QBank? We've got a few options. So we say, well, which one's going to increase your score the most? Mehlman QBank. So why don't we do that one? Right? I mean, you can do the alternatives, but you just have to accept that, your augmentation score is not going to be as robust. The millionaire mindset, what do I do when I blank on exam day? Well, hopefully it doesn't happen, okay? Hopefully you don't blank on exam day. I've talked about how it's a psychological screening test, the notion of anxiety. If you are doing, like, let's say an NBME exam and you like cake out on the 4th block because you're like, oh, I get anxiety on the last block, or like you're worried about blanking out and stuff like that. Well, that's a screening mechanism to weed you out of the medical profession, because we can't have people who like fuck up a surgery because they're like, oh, I blanked out. Sorry. That vessel there, I didn't mean to like ligate that vessel. I blanked out. Or you're like in with a patient, family med consult, and they're like, are you listening to me? And you're like, no, I was like blanking out. And they're like, all right. And you're like, all right. Like, we can't have that. So you got to like hold yourself together. Psychological screening test, in addition to the knowledge acquisition. Big D, you've asked the same question like 6 times. When to take self-assess, T-Babu, Biduk, when to take self-assessments, when are the best I mean, do the NBMEs after you finish QBank, that's all. Adham Tarek, you did an NBME, you got 40%. Obviously not anywhere near where you need to be. You're gonna have to do a lot of QBank. Adham Tarek, a lot of QBank is what you need to do. Gaurav Mishra, why Japan? When I was in 4th year medicine, I came here to Osaka for 3 days over New Year's with my ex-girlfriend, who was Aussie at the time. And I was like, done. I was like, I'm moving here. That's what I told her. I was like, I'm moving here. And she's like, I believe you. And I was like, yeah. She was going into medicine too. She ended up going to like, she's like a doctor in like South Australia now, but like, she's like, I believe you. And I was like, it's going to happen. It's crazy. Paolo Nato. Does it make sense to do the first pass Mehlman QBank and the second pass UWorld? I mean, you don't need to do UWorld after Mehlman QBank. If your NBMEs are sufficient, you can just sit. If you have a lot of time after you finish Mehlman QBank before you sit the real USMLE, by all means, you can do a second QBank like UWorld. And as I've articulated, the juxtaposition of having Mehlman QBank alongside, let's say, UWorld or AMBOSS, you can compare and say, yeah, Mehlman's is better. Momin Kashif, you just did your first NBME, which was, you did NBME 27. You got a 65%, which is passing by a singular question. So you could do another NBME. I'd want to know how far out from your exam you are. And if you're far out from your exam, I'd be like, there's no point in doing another NBME. Just you got to do QBank, do Mehlman QBank. If you're near your exam, let's say you want to sit in like mid-September or something, I would have you sit the other NBMEs, and we need you getting 68 plus. If you're not going to get 68 plus, if you're getting like 63, another 65, like, I'd be like, it's precarious. I'd rather have you postpone and do Mehlman QBank for a month, come back, have higher NBME scores. I don't want you YOLOing into the licensing exam. That's why. And you shouldn't be using the NBMEs to get above pass. Okay. Ness, is it safe to take the test with NBMEs 28 through 30, 70 to 73%? Absolutely. 65% is pass, 68 plus 3 plus NBME is what we want. Your year-old self-assessment was 61% done after an 8:30. That's extremely annoying. That's extremely annoying for everyone involved because your NBMEs are what matter and they don't lie. But the 61 on year-old self-assessment, the NBMEs matter, but that creates a doubt. And so to overcome that doubt, we now need you doing other NBMEs. Like I'm assuming you already did 20 through 27, Ness, I'm assuming. So we would be in a situation where it's like, now we're going to have to do like 19, 18, 17, 16, do like 4 of those NBMEs. And then they're all like 75%. We're like, we're good. No worries. You're good. But we're going to have to, regain some reassurance by having you do other forms now. And they're just as accurate. Don't worry. Let's see. A lot of you guys asking the same questions. Abu Bakr. That's not like a standard way that I would prepare for USMLE in 2025, Abu Bakr. That's not like a standard thing. That's like old stuff. Dr. NK. A female with dermatomyositis as paraneoplastic. Why did her brother have rheumatoid arthritis as history given in one of your video questions? Will you please explain? Well, it's a very scattered question. And I'm going to like resynthesize that basically, which is you can get dermatomyositis as a paraneoplastic of ovarian cancer. If you guys haven't heard that before, they asked that on the USMLE. It's not like one specific ovarian cancer. Like it can be serous adenoma or serous adenocarcinoma of the ovary. It's not one specific one, but just ovarian cancer in general can cause dermatomyositis. And there's some statistic where it's like up to 25% of women who have dermatomyositis actually have an underlying ovarian lesion. Okay. And then you say the brother rheumatoid arthritis. I mean, I would have to see the question, okay? But in general, autoimmune diseases go together. So like if you have an autoimmune disease and a different autoimmune disease in the patient or a family member, that increases the likelihood of autoimmune diseases. So if they give you, let's say, one of the examples they really like is primary biliary cirrhosis, which will be a woman 20s to 50s with high ALP, high direct bilirubin, high cholesterol, generalized pruritus. And they'll give you, let's say, an autoimmune disease. They'll say like the brother has RA. She has history of autoimmune subacute granulomatous dequervating thyroiditis 4 years ago. So they like giving you a history of autoimmune disease. Indrashish Podlar. You're scoring well on NBME, but you feel like you're answering a lot based on intuition without actually knowing it. Is that normal? That's fine. As long as you get the questions right, does it really matter? Aksa Sohail, you got your fail recently. Your orange bar was lower performance. Should I consider a retake? How much time should I give? Well, there's so much information we don't know. So can you tell me more information there? If you're going to retake USMLE, when do you want to sit it? And we would have you do QBank, like Mehlman QBank. EM Chemo, you're an IMG planning your USMLE prep. You repeated first year med school. You've done well since. Would this be a red flag and how much could it affect my chances? Oh, I've talked about this, that the notion of taking time off or having these setbacks, it's far overrated. It's far overblown in terms of any negative impact. In other words, they're just going to pretty much look at your 2CK score as a general reflection of your competency. So like, let's say you walk in there and you have like a 262 on 2CK, but then you like failed something in first year, or you like failed a rotation, or like you took 6 months off, whatever. They're just going to say, he's capable. She's capable. Like life happens. So like things happen. But then objectively, it's just like they're capable. They're clearly like smart enough to get this score. Clearly, they can, there's propensity toward competency based on your score. but it's overblown, those setbacks, in terms of how they negatively affect you. You just can't have entitlement regarding certain places that are hyper competitive. You can't have entitlement. You can't expect to apply to like radiology at Stanford with like, a fail or something. But you could have a fail and get like a good USMLE score and match like tons of places. So I would even go out on a limb and say like you could even have a fail and still match at those really competitive places insofar as you rotate there. Like you could literally rotate at like one of those places, meet the people there, and like they would still probably like overlook that because they really want people who are competent and are good players, team players. And if you demonstrate that when you're there, like they'll overlook stuff. That's my guess. Hakam Suleiman. What's the raw equivalent percentage for step 2, 250? Probably around like 80%. Because like I'd say 74% is like a 240. So maybe around 80% for 250. Osmond, do you know any crash course for USMLE? Well, what are you looking to do exactly? Are you looking for videos? If you are, just do the Mehlman YouTube videos for all those questions. That's as crash as it gets. Just blast through those videos. Blast through our PDFs, blast through the Mehlman That's all crash course, isn't it? Paulo Nato. I feel like I don't understand UWorld's solutions as well as I should. What could I do without spending like 10 minutes per question? It's just accountability. You need to move forward. I'd say no more than like an hour per 10 questions. So it's just accountability. It's like the same way you pace yourself answering questions, you need to pace yourself reviewing questions. So if you're the deep, meticulous OCD type, you need to have some accountability. It's not an excuse for lack of efficiency. Like if you're very meticulous and judicious, reading everything, assiduous, there's still accountability. It's like it's not an excuse. Ramsey, you'll do your first NBME in 2 weeks. You're almost done with UWorld. You did biochem, genetics, neuroanatomy, PDS, high yield arrows. What's your advice to do in the 2 weeks? I feel like I forget what I study. You said your first NBME will be in 2 weeks. Well, you're just going to do QBank up until you take the NBME. And you'll do Mehlman PDFs as well. Just continue with that. Paolo Nato. In Anki, is enough to remember the answer on the card, or should I read the supplement until I understand the reasoning? What do you mean the supplement? That's not anything that relates to like Mehlman Anki. So that's not anything that relates to like our stuff. There's no supplement. It's just a front and a back. And for those of you who like close, we don't like close cards. Front and back is superior in my view. S says, you're an Indian IMG in your third year med school and you were just looking up how to use free resources effectively. Could you please tell me a pathway if it's not a hassle? We'll just read the Mehlman PDFs every evening and do the YouTube MCQs. I'm assuming you're doing QBank. So alongside QBank, you should be doing the Mehlman PDFs and the YouTube MCQs. Do the Mehlman YouTube playlist. That's a QBank also. That stuff's all free. Assam Kareem, does QBank score correspond to pass against step 1? Like you're 66% overall correct on QBank with 50% complete. Of course, there's going to be a correlation, but I don't think we should read into it too much because it's the NBME scores that matter. So whether you're getting 60% correct in QBank or whether you're getting 80%, although there's going to be a correlation, we still just want you to sit the NBMEs, and that's what actually matters. Todor, you're starting IM residency in Germany in November. Should you sit for step 2 before residency or do it next year? Sit it before residency if at all possible. But if your score is going to be like bad, then you would have to sit it when you're in residency. But when you're in residency, you're going to be really busy. That's all. Ostrid Parker, how do you incorporate Anki into studying for step one? Do I do the cards for your UWorld incorrect questions? Terrible question. Man, that's like, there's always a cuck question. That's one of them. Because there's stuff I'm not reading out loud as well. It's like massively cuck. It's not how you prepare for USMLE. But regardless, I've said numerous times that like you don't need to make cards from QBank. EM chemo. You're an IMG planning a USMLE journey, repeated first year for medical reasons, but have done well since. Would this be a red? I just talked about that. That stuff's overrated. Chat moved on me. Syed. What if I did Mehlman step 2, 3 QBank plus Mehlman Anki YouTube playlist for 2CK plus CMS second QBank third? You're just saying all this stuff. I mean, yeah, that would be more than enough. Syed Mohammed. Joe, you plateaued at 62% NBME step 1 in 3 weeks. But yes, Syed, that's obviously like more than enough. Obviously, very comprehensive. Syed Mohammed. Joe, plateaued at 62% NBME step 1 in 3 weeks. What should I do? You don't want to push your exam date? Well, you might have to, because if your NBMEs aren't a bare minimum 65, you're not going to pass. And it's precarious getting under 65 going into step 1. I wouldn't recommend it. I've already said that you should be getting at least 3 NBMEs that are 68 plus in order to have a buffer / safety to pass step 1. The Haid 123. Are you still close with people from your med school? Yeah. I mean, I went to med school in Australia, so I was just in Australia in June, and I saw people from med school there. So, Syed, Leslie. Yeah, I just answered that, Leslie. Migs, for step 2, once I'm taking NBMEs. NB, do you have a list of high-yield topics for step 2 CK in your PDFs? We've got all the PDFs that are different to CK as well, like IM, PEDS, OBSGYN. We've got all those PDFs. I already answered that. IM chemo. Nostalgia. What do you suggest for me? You want to just pass step 1 exam as someone who is not that good at basics. Thanks a lot. Too general. You got to start on QBank. Which QBank are you doing? Have you started on Mehlman QBank? That's your starting point. Nostalgia. You guys like spam the same questions. Sai Krishna, how much time does it take to complete Mehlman QBank with dedicated time? A month and a half. Month to a month and a half. Probably. A little, like 5 weeks. You could do it. 5-6 weeks. It's 2,700 questions for step 1. 2,450 for 2CK. 1,550 plus for step 3. Jazz Raghu, you're a family med doc in England. You're scoring 50s in NBMEs, 26, 27 back in February. UWorld incorrects done. Delayed exam twice. How would I improve my knowledge base? By not doing UWorld incorrects. I would improve your knowledge base by doing Mehlman QBank. And then I would say, which PDFs of mine have you read? And you're like, none. Have you looked at Mehlman PDFs? You're a doctor. Like, if you read Mehlman PDFs, you're gonna be like, fuck. It's to my observation that people who are already doctors are the most impressed with my material. Maybe because you've like been around the block already. So like, you can understand, you have a better perspective as to like what's good and what's not good. But I have like, I want to keep anonymity. I'm gonna keep on anonymity. But I've had a program director who's a cardiothoracic surgeon who had like reached out to me saying that he like went through my arrows and went through my cardio and he was like blown away. And I was like, all right, that's weird. Like, to get that email. And then I'm just going to keep anonymity. see the chat mode. Do you still recommend Clinical Master Series for Complex 2? Yeah, I do. Ali H. What's the raw equivalent percentage for 265? Probably like high 80s. Will a 230 and 2CK be looked poorly upon by programs? No, that's fine. You just need to pass. How can I overcome a low score and match psych? You're perfectly fine. Psych, not hard. 230 is fine. Don't expect to get an MGH, but psych, that's fine. 230, it's fine. Let's see. Big D, it's okay. We're just gonna do an hour. Dr. Mike, you seem to forget a lot of details about diseases like specific pathophysiologies. It's normal. It's normal to forget things. Is step 1 exam like the NBMEs or harder? Champion, any predictions of champion? I'm just focused on like putting out good stuff, you know what I mean? That's the focus. There's a lot of like business talk that we're not gonna, like I don't want to go into on a live stream. Aditya, hey Dr. Mike, how should we learn identifying histology and radiology images? Will there be questions on step 1 that are pure image? Yes, QBank is good for histology. All the Mehlman PDFs, all the histo is in there. So like, for example, if you do the renal PDF, you'll see images in there that are high yield for histo. We put them in there. If you do GI, you'll see high yield images that are in there if they're necessary. Like you'll see images throughout our PDFs. Now radiology is more hit or miss, okay? Like I don't think, like, for example, I don't think we need to make a radiology QBank. You say you could make like a radiology 600 question QBank or something, but it's like the purpose is USMLE, not like general medicine. Like we're not like, our goal is not to make you like feel good that you're like, I know my CTs really well now. That's cool, but does that help you for USMLE? Like not really. Like I'd rather just have you do like other stuff. So radiology, hit or miss, just kind of like haphazard study while you're doing our QBank, but histo, it's all throughout our PDFs and also in our QBank. I'll answer like one more or a couple more. We'll just do an hour. Best way to deal with experimental questions. Well, you don't know which ones are experimental, so it's sort of irrelevant. How about some music in the background? I could. Armin, you purchased all of our contents. Awesome. Just what strategy is best to study your Anki? Based on incorrects on your QBank Qs or just random? So you're going to do the Mehlman QBank, 40 questions per day minimum. So 4 blocks of 10 untimed tutor random Armin. And then you're going to do minimum 4 hours of Mehlman Anki after you finish that. If you can do more work, then you can titrate upward the number of questions. So rather than like 40, you can do 50, 60 blocks of 10. Okay. And then do Mehlman YouTube questions when you're like at the gym or whatever you're doing. How do you recommend reading your PDFs or remembering them while still doing 80 questions per day? By just reading and trying the best you can to remember. I mean, I really do understand and empathize that like reading is hard for a lot of people. So you're like trying to read and you don't remember what you read. I understand that's like a big thing for people. But you just gotta do the best you can. Like you can do like 20 pages per evening. So you can do like, let's say, if your strategy is gonna be like the PDFs over the Anki, for instance, you could do like, and you wanna do 80 a day as you're asking about, you could do the 8 blocks of 10 untimed tutor random, and then unrelated to that, just like read the PDF subject specific as you want. So you're going to say, I'm going to read cardio PDF, like 10 pages per day, 20 pages per day for the next like week, whatever you're capable of doing. And I'm going to do the cardio questions in the YouTube cardio playlist, like 10 per evening. So you're doing random mode in QBank. But after you finish that, you're going to do subject specific cardio PDF, cardio playlist in the YouTube. Like that's an option to essentially co-study random with subject specific as you're moving through. I'm going to answer one more question. Tiwa Rachel, you're an IMG from Ghana. Use Mehlman PDFs and videos plus eWorld. Do I still need Mehlman QBank before NBMEs? If you're not poor. If you're not poor. If you're poor, don't come near us. I mean, I imagine most people in Ghana aren't like rich. But if you're concerned about like your phone bill, like if you're concerned like my phone bill is $29 a month versus like $49 a month, or like this sandwich is like $13 versus $16, if that's like on your mind, or how much your rent is or how much your electricity is, like don't do our QBank. But your scores would go up. You know what I'm saying? Your scores would go up if you did it. Migs, I don't even know what your question was. But we did an hour. Okay. Might do more of these, right?